everyone. Hi there, and welcome back to Wellness Wednesday, where experts share insights on topics that are important to pancreatic cancer patients, survivors, and caretakers. I'm Angela Horn with Rolfe Pancreatic Cancer Foundation, and I am honored to be co-presenting today's discussion on navigating cancer and neuropathy alongside Savina Chacheva with Cancer Wellness Center and Amanda Homscheid with the Foundation for Peripheral Neuropathy. For those of you that are new to our organization, I'd like to tell you a little bit about Rolfe Pancreatic Cancer Foundation. We are a Chicago-based research foundation that funds early detection pancreatic cancer research at some of the nation's top institutions. We connect patients and families with medical experts, personalized resources, and education, and we raise awareness to heighten the public's understanding of the disease, its symptoms, and its risk factors. We host fundraising and awareness events throughout the year and also conduct quarterly Wellness Wednesday programs to bring a range of engaging topics to our pancreatic cancer community. Before we dive into today's speaker, I'd like to welcome my partners, starting with Savina Chacheva from Cancer Wellness Center. Savina, take it away.
Thank you so much, Angela, and thank you to the Rolfe Pancreatic Cancer Foundation and the Foundation for Peripheral Neuropathy for partnering with us today. We're really grateful for that relationship. For those of you new to the Cancer Wellness Center, I'd just like to take a minute to tell you more about the organization and our services here. The center was founded in 1989 as a nonprofit organization with the mission to help anyone touched by cancer find a way forward. Each year, our free counseling services, support groups, and health and nutrition programs serve over 2,000 community members of all ages and backgrounds. People with cancer, family members, friends, and caregivers all come to us to connect and cope. Our services, which are both virtual and in person, include education programs like the one today that aim to help you navigate the varied challenges that come with living with a cancer diagnosis. Wellness classes like yoga, meditation, nutrition, exercise, and more that provide a holistic approach to healthy living. And support services, which include counseling for individuals, families, couples, children, and those bereaved, as well as support groups that are designed to help our participants manage the mental and emotional impact of cancer. To learn more about the center and connect to our free programs and services, please visit cancerwellness.org, and the link will be included in the chat. Thank you.
Thank you, Savina. It is always so wonderful to partner with Cancer Wellness Center and promote the amazing work you do to support cancer patients and their loved ones. Amanda Homscheid is also with us today from the Foundation for Peripheral Neuropathy. Amanda, tell us more about your organization and the resources you provide to those struggling with neuropathy.
Thank you so much, Angela. I'm Amanda Homscheid, and I'm the program manager from the Foundation for Peripheral Neuropathy. At the Foundation, our mission is to advance the discovery of new therapies and cures that improve the lives of everyone impacted by peripheral neuropathy. We support this mission by funding innovative research, advocating for increased federal support, providing educational resources for patients, and raising public awareness of peripheral neuropathy. But the most important piece of our organization, and above all, is that we serve as a bridge that connects patients and caregivers with research and medical communities. We encourage those with neuropathy, including neuropathy caused by chemotherapy toxins, to connect with a neurologist that specializes in peripheral neuropathy, who can help manage symptoms and develop a personalized care plan tailored to their needs. Our hope is that with the right support and tools, people can better navigate life with neuropathy and continue working toward more effective treatments.
Wonderful. Thank you, Amanda. We are so grateful for your foundation's partnership as we cover this important topic. Today, we have with us Dr. Stephanie Geisler of Washington University in St. Louis and Dr. Zahava Berkowitz of EMA Acupuncture and Wellness to discuss navigating cancer and neuropathy. We hope from our time together, viewers can gain better insight and tools for managing nerve-related discomfort and enhance their daily well-being. We'll begin our discussion with Dr. Geisler's presentation and then introduce Dr. Berkowitz and the complementary approaches available to ease neuropathy symptoms. Our session will conclude with a Q&A featuring both presenters. So if you have any questions, we encourage you to type them in the comment section below. If you prefer to submit questions anonymously, you can email us at info@rolfefoundation.org. That's ROLFE foundation.org. We'll be saving all questions until the end to make sure we're able to get to as many as possible. Dr. Stephanie Geisler is Assistant Professor of Neurology and Director of the Center of Excellence for Neuropathy Research and Treatment, CENTR, at Washington University School of Medicine in St. Louis. Dr. Geisler is a leading expert in neuropathy research focused on improving outcomes for patients facing chemotherapy-induced side effects. Her work is helping shape the future of treatment and care, supporting Rolfe's mission of improving quality of life through early detection and compassionate support. Dr. Geisler, welcome.
Angela, thank you so much for this kind introduction and welcome everyone. I will talk a little bit about chemotherapy-induced neuropathy from a neurologist's perspective. Chemotherapy-induced neuropathy is one of the most common persistent treatment-related complications, and it affects up to 60% of cancer survivors. As the name implicates, peripheral neuropathy affects the peripheral nervous system, which is in contrast to the central nervous system, which consists of the brain and the spinal cord. So all these nerves in yellow can be affected by chemotherapy. You may have seen, some of you, a neuron drawn with its extensions, but that's just a very simplification. If we would really draw it to scale, then the cell body would be this small dot, and all the axon is the rest. So you can see that these nerve cells have a lot of stress, especially if there's chemotherapy in the body, because they will have to transport things from the cell body to the endings, and then from the endings back to the cell body to signal to the brain. So both sensory and motor nerves can be affected by chemotherapy-induced neuropathy, but typically we have more sensory nerves than motor nerves. And the reason is that the cell bodies of the motor nerves lay in the spinal cord, and as such are protected from the brain blood-brain barrier. However, the cell bodies for the sensory nerves that convey pain and feeling, they are in what we call dorsal root ganglia outside of the spinal cord, and they are not protected by the blood-brain barrier. So in addition to sensory nerves and motor nerves, autonomic nerves can be affected. And autonomic nerves are all the nerves that innervate our internal organs, such as the eyes can cause dry eyes, dry mouth, the heart so causing lightheadedness when getting up from a seated position, and also the GI tract causing constipation and diarrhea. So chemotherapy-induced peripheral neuropathy typically starts during chemotherapy, usually towards the later cycles. It typically starts with sensory symptoms, and I talk in the next slide about what those are. It can also cause weakness of hand and feet. Typically, symptoms are symmetrical, often get worse while chemotherapy continues, and it can even worsen after chemotherapy has ended for about 3 to 5 weeks to a few months. In many patients, neuropathy symptoms do improve after chemotherapy has ended. So common sensory symptoms are numbness and tingling, typically affecting the feet and hands, burning pain, cold allodynia. So if you touch something cold, it's really painful. It can also cause hand weakness and food weakness, imbalance, and then the autonomic symptoms I just mentioned. There are a few red flag symptoms. If you have asymmetric symptoms or profound weakness or weakness as the first symptoms, or symptoms affecting your upper thighs and upper arms, or if the neuropathy is rapidly progressive, it's very important to immediately see a neurologist because other things might be going on. So the question is, okay, you're getting chemotherapy. Will everyone who gets chemotherapy has a risk of developing peripheral neuropathy? And the answer is no. However, the drugs that are most commonly used for the most frequent cancers belong to platinum drugs, taxanes, vinca alkaloids, and proteasome inhibitors. And all those drugs, like platinum drugs, cisplatin, carboplatin, oxaliplatin, paclitaxel, vincristine, and for proteasome inhibitor bortezomib, they all have a very high incidence of peripheral neuropathy. And when you see what these drugs are used for, lung, colorectal, breast cancer, leukemia, lymphoma, and multiple myeloma, these are some of the most common cancers. So chemotherapy-induced neuropathy is actually very common. But if you are treated with chemotherapeutics that are not in these 4 classes, your risk is not higher than in the general population. So these are different drug classes, and they all have different mechanisms of action. So one study we did together with the Foundation for Peripheral Neuropathy is trying to identify, are there differences in symptoms and what are actually the important symptoms and exam findings in different chemotherapy-induced neuropathies. And so the Foundation for Peripheral Neuropathy, as one of their projects, they have the Peripheral Neuropathy Research Registry, and some of you might maybe even be in there and be part of the study. So currently, there are over 2,000 subjects enrolled, and we specifically looked at patients with chemotherapy-induced neuropathy. And we identified patients who were treated with one of these drugs of all 4 classes. And we also compared it to diabetic neuropathy to see what is really maybe the same or different for in chemotherapy-induced neuropathy, because this will also be very important to develop effective treatments. So these are somewhat complicated graphs, but basically on the y-axis, you have the number of patients that have the symptom, and on the x-axis, the symptoms. And as you can see, almost all patients have 80% of patients treated with the different chemotherapeutics have numbness in their feet, and a lower percentage, typically around 60%, also have pain. And that's fairly similar between all neuropathies. However, the involvement of hand symptoms is quite different. Patients treated with platinum drugs, such as oxaliplatin, have much higher, many more patients treated with platinum drugs have numbness in their hands than, for instance, patients with diabetic neuropathy. And that's also true for taxanes, paclitaxel, and vincristine. Pain intensity is typically highest in diabetes and pretty high in bortezomib-induced neuropathy, but is much lower with platinum-induced neuropathy. Further indicating that really numbness is a big problem in patients who have platinum-induced neuropathy. And as you can see here, everybody who has numbness is in gray, and the pain scale is indicated from no pain to the most severe pain that you have to go to the emergency room. Everyone who has intense pain and is treated with platinum also has numbness. Patients also frequently have distal weakness, and there, especially patients treated with vinca alkaloids like vincristine, patients who are treated for leukemia or lymphoma, especially have high foot weakness. And then also a high proportion of patients will have decreased fine motor functions in their hands. When asked what the most bothersome symptom is, typically people think it's always pain, and about 50% of patients treated with a proteasome inhibitor, bortezomib, name pain as the most bothersome symptom, but about 50% of patients treated with platinum or taxanes name numbness or tingling as the most bothersome symptom. And patients treated with vincristine, there are the most patients who also name weakness as most bothersome. So how is chemotherapy-induced neuropathy evaluated? So if we are interested in motor nerves, we check the muscle tone, we check the strength and the reflexes. And for strength testing, I also use a grip meter, and that's my Ballard handheld dynamometer. And then to test sensory nerves, we have different sensory nerves to test large axons that are important for telling us where your body, to telling your brain where your body is in space. We use a tuning fork to test vibration. And then the thinly myelinated and unmyelinated A delta and C fibers that convey pain and temperature, we use a pin. And then for selected patients, we also can do autonomic testing. So if we go back to our neuropathy cohort from the Foundation for Peripheral Neuropathy, we can see that all these nerve functions are quite a lot affected by a lot of patients. So in gray is the percent of patients who are normal, and red and orange is when it's abnormal. And you can see that vibration sense at the toes is abnormal in almost all patients with chemotherapy-induced neuropathy, and a little bit less in patients with diabetes. And similarly, sensation to pinprick is abnormal in almost all. Furthermore, we have decreased strength in toe dorsiflexion and ankle dorsiflexion, so bending back your toe and ankle, and almost all patients have absent ankle reflexes. So to summarize, what we frequently find in patients with peripheral neuropathy is patients often do not have ankle reflexes anymore. There's decreased sensation to vibration at the toes and ankles, decreased sensation to pin in a length-dependent manner, meaning that you may not be able to feel the pin at your toes, and then it gets a little bit better when we go further up the leg. And in some patients, we also have weakness of fingers, wrists, and or ankles, and imbalance. For some patients, that's all that's needed. Other patients may need further workup to further characterize the peripheral neuropathy. And in our clinic, we almost routinely will do EMG nerve conduction studies to get a better understanding of the peripheral neuropathy. Laboratory testing to rule out other causes of peripheral neuropathy. So we always test for diabetes and vitamin deficiency. And sometimes if EMG nerve conduction studies are normal, we can evaluate these small unmyelinated axons with skin biopsy. And that's just a little punch, it's local anesthesia. That's what it looks like at the end. So you can see it's really small. And then we look under the microscope and we really count these small unmyelinated axons as they innervate the skin and can determine whether there's axon loss or not. Common risk factors are the cumulative dose of chemotherapy, if patients have pre-existing conditions, and there especially if patients have diabetes or pre-existing peripheral neuropathy. Some genetics, especially for vincristine, if patients have a hereditary neuropathy called CMT1A, Charcot-Marie-Tooth disease 1A, that giving vincristine is an absolute contraindication because it would make the neuropathy much worse. Strong alcohol consumption and obesity. Treatments. During chemotherapy, the oncologist may decide for dose reduction or discontinuation, and then treatment at this point is symptomatic. As you could see, a big problem of peripheral neuropathy, chemotherapy-induced neuropathy, is numbness, but there is no pharmacological treatment for numbness yet. If you are treated and the goal is to treat numbness and you're getting a drug, it's probably not going to help. For positive symptoms, pain and tingling, there are 5 neuropathic pain medications. Duloxetine, also called Cymbalta, has been shown in one study with patients getting oxaliplatin to somewhat improve pain intensity. Gabapentin, also called Neurontin, or pregabalin, called Lyrica, are probably the most commonly prescribed drugs and can be quite effective. Other ones are venlafaxine or Effexor, which is an antidepressant, as is duloxetine, or nortriptyline and amitriptyline, which are typically given at night. There are no good data on CBD for chemotherapy-induced neuropathy, and other treatments can be topical, especially if symptoms are restricted to the feet, or some patients have symptoms only at night, so their topical treatment might be quite effective. There are a lot of non-pharmacological treatments that can be helpful. A lot of those are only now in early clinical trials. Massage therapy. I'm a big fan of yoga and Tai Chi, but especially yoga because it improves strength, flexibility, circulation, it decreases inflammation, and it's good for well-being. There are some clinical trials starting right now evaluating yoga for chemotherapy-induced neuropathy. Meditation, I think, can be very helpful to learn to basically live with some discomfort and pain and to dissociate yourself with it. We will hear about acupuncture in a little bit. There are quite exciting new clinical trials going on showing the effect of acupuncture. You do want to have a healthy nutrition, and typically we say a Mediterranean diet would be very helpful. And then physical activity and exercise is very important. However, with physical activity and exercise, you have to be a little bit careful what to do. I typically recommend my patients to not use a treadmill for exercise because a lot of patients have pain in their feet and they have imbalance, so they can stumble and then they can fall down. So better would be a stationary bicycle, aqua aerobic, swimming, rowing, these things. Other than that, foot care is very important to make sure that you don't have any unnoticed injuries or infections. Wear well-fitting cushioned shoes. You may need to see a podiatrist. And very importantly, minimize fall risks in the home. And your physician can give you a whole pamphlet about what to do to decrease fall risk at home and potentially put out handrails. As I just said, there are currently no treatments for numbness, and the treatments for pain are not always 100% effective. So there's a lot of research going on about chemotherapy-induced neuropathy. So for the longest time, it was so, and so we got a lot of the information we have now from basically initially just experiments with nerve cut in mice. And so for the longest time, it was thought that if you cut a nerve like here, that it would just wilt away, the end would wilt away like a leaf in the fall, and that's why the axons degenerate. However, it turns out that this is not the case, and a lot of research in the last decade has identified a protein called SORM1 as the central executioner of axon degeneration. So typically, if we cut an axon, it will degenerate because SORM1 is activated. However, if we can get rid of SORM1, the axon is protected although it is cut. And I show this here. So that's a cross-section of a sciatic nerve from a mouse. And all these little circles are cross-sectioned axons. And that's an uninjured nerve. But if it's cut, you can see you have much fewer axons, and the axons that remain, the nerve fibers, look really weird because they are degenerating. And that's already after 7 days. However, if we can get rid of SORM1, after 7 days, one can't even see that the nerve has been cut. And even after 2 weeks, the axons look very intact. So we tried to see whether that also has an effect in chemotherapy-induced neuropathy. And we were the first to show that deletion of SORM1 protects from vincristine-induced neuropathy in a mouse model. And you might be able to see this here. If wild-type mice are treated with vincristine, they have these really weird-looking nerve fibers. However, if SORM1 is not there, the nerve fibers are perfectly intact. And that's quantified here. Very importantly, getting rid of SORM1 also protected from pain, and we test this with these little filaments in mice, and if they withdraw their paw to smaller filaments, then this withdrawal threshold goes down. It means these mice have pain, but if we don't have SORM1, then the pain has been prevented. And since then, we and others have shown that basically all chemotherapeutics of these 4 main different classes all activate SORM1. SORM1 then decreases something that's called NED, which is like the fuel for the cell, and axons degenerate. So that's a very exciting finding because this gives us something to target to prevent chemotherapy-induced neuropathy. There are 2 options. Either we maintain NAD or we block SORM1. We can maintain NAD by taking nicotinamide riboside, a vitamin B3, which is freely available in food supplement stores. It has been shown to be safe in large open-label clinical trials in humans that have been done over 6 to 9 months. And that has been shown in an animal model to prevent paclitaxel-induced neuropathy. However, there are currently no data yet in human patients of the effect of nicotinamide riboside on chemotherapy-induced neuropathy. And NAD can fuel some cancers, but not others. So if you wanted to consider taking NR, you should talk to your neurologist or oncologist to make sure that it is safe. So then the other new treatment approaches would be to inhibit SORM1. And it has been shown several SORM1 inhibitors have been developed now, and it has been shown in an animal model, again, to protect from paclitaxel-induced neuropathy. And NeuraBio has initiated a phase 1 clinical trial for their oral pain-penetrant SORM1 inhibitor, NB4746. Phase 1 means it's tried in healthy volunteers. And Eli Lilly has acquired Disarm Therapeutics, which was developing SORM1 inhibitors and is also currently in a phase 1 trial. And I think they started a phase 1b/2 trial. And there are currently 4 or 5 companies who are developing SORM1 inhibitors. We have, in addition, worked on developing SORM1 gene therapy. There we use an AAV that's used also in other therapies and express a construct that can block SORM1. And if we inject this in mice, typically after a nerve cut, you can see the nerve fibers are completely destroyed. However, if we inject this nerve therapy, then nerve fibers are very nicely intact, as you can see, completely gone if SORM1 is still there, and completely intact if SORM1 is blocked. And we currently also show it in bortezomib-induced neuropathy that SORM1, what we call dominant negative gene therapy, can block neuropathy. So to summarize, chemotherapy-induced neuropathy is a common side effect of some of the most frequently used chemotherapeutics. Symptoms are symmetric, start in feet and or hands. Chemotherapy-induced neuropathy is sensory predominant. It can also cause imbalance. Treatment at this point is symptomatic. There are several important non-pharmacological options that should be explored. There are treatments on the horizon. The probably most promising and exciting right now are SORM1 inhibitors or gene therapy, which are currently in development. Thank you so much for your attention.
Thank you, Dr. Geisler. Your expertise on the subject and presentation on the treatments upcoming are so exciting. As a reminder, we will be saving all questions for the Q&A section at the end of our session today, and we will do our best to address as many questions as we can. You can either jot your questions down in the comment section below or submit questions anonymously by emailing us at info@rolfefoundation.org. Next up is Dr. Zahava Berkowitz. She is a doctor of acupuncture and the founder of EMA Acupuncture and Wellness, an acupuncture clinic in Northbrook, Illinois, committed to honest, down-to-earth healing. Dr. Berkowitz is a trusted practitioner in integrative medicine, offering acupuncture and wellness care to those facing cancer and chronic conditions. Her work, especially with the Cancer Wellness Center, reflects a deep commitment to healing and holistic care, core values shared by the Rolfe Foundation. Thank you for joining us, Dr. Berkowitz. Welcome.
Thank you so much. Thank you for having me. I'm so blown away by Dr. Geisler's presentation. It was truly incredible to see. So I'm here to talk about acupuncture and represent the world of integrative alternative medicine, specifically relating to chemotherapy-induced peripheral neuropathy. So a little bit about us. I have my doctorate in acupuncture, and I started a clinic 7 years ago in Northbrook called EMA. EMA means mother, and our goal is to nurture, guide, and accept people just like any good mother would. I was introduced to the Cancer Wellness Center many years ago. One of my first patients ever in my clinic was a woman with ovarian cancer, and she had pretty bad peripheral neuropathy. And I remember just looking at all of the books I could about acupuncture and the treatment of neuropathy, feeling so dedicated to getting her results because, you know, anybody who has neuropathy knows it is so uncomfortable, so unpleasant. And so I ended up working really hard with her and we got her great results. And she's the one who put me in touch with the Cancer Wellness Center. And since then, my clinic volunteers at the Cancer Wellness Center monthly. We do free acupuncture there for people going through cancer treatments. And it is such a joy for us. Starting January this year, we started having them come here. So even before I knew about the Cancer Wellness Center, I had moved my clinic across the street to Cancer Wellness Center. So we were going there monthly, and now we have their patients come to us and we can give them full acupuncture treatment. And the number one thing they're complaining about is their neuropathy. It's the thing we hear about the most and the thing they want to spend the most attention on. So just so you know, acupuncturists actually do have it's a 4-year Master's of Science degree, and you can get an additional doctorate. So I studied acupuncture for 5 years in order to get my license. And in Illinois, it is a licensed and regulated profession. So if you are going for acupuncture or seeking care, please make sure that you're going to a licensed acupuncturist. And usually they'll have the letters LAC, DAC, MSTOM, or DACM behind their name. And I like to say acupuncturists were basically experts in symptom management. So if you have cancer and you're seeing your doctors, you're on your medication and you're getting treated responsibly and you're in their care, yet you still have certain side effects, fatigue, nausea, anxiety, that's where we can come in and help support your side effects in a non-pharmaceutical way. So what is acupuncture? For those of you who have never had it, it's basically under the umbrella of traditional Chinese medicine. We're part of integrative or alternative medicine. We work with a lot of different physicians in our clinic that refer us patients for things where there maybe are even on something like gabapentin, and it's still not helping. And so maybe we can come in and provide some support. So basically, we are putting very thin, fine needles at specific points in the body to help stimulate the nervous system. So this is a system that is over 2,000 years old, and research has showed that acupuncture helps release endorphins and other neurochemicals to help regulate pain and inflammation in the body and overall just make you feel better. The mechanism's super interesting. In conventional medicine, there's tons and tons and tons of research about acupuncture, and it's been really hard to pin down exactly what the mechanism is, but we do know what happens to the brain when you get acupuncture, and we'll go through that a little bit. But we know that acupuncture sends signals through the nervous system to the brain, helping turn down the body's pain response. So I would say the number one reason people initially come to acupuncture is for the treatment of chronic low back pain. That's kind of what we're known for. But we treat so many other things and can help anybody in chronic pain. So we know it triggers the release of natural pain relieving chemicals like endorphins and the body's own opioids, and helps the brain respond better to them. So basically, we're influencing brain chemicals and we're involved in reducing pain and inflammation. You know you're going to a real acupuncturist when they're treating things distally. So what I mean by that is just because you have pain in your back, it doesn't mean the needles are going in your back. And this is because acupuncture works systemically, not just locally. So I would always be wary if you have, let's say, tennis elbow and they only put needles in your elbow. To me, that's not really true acupuncture. And just a little overview, I have so many talks about acupuncture, so we're not going to get in detail too much about it. But in case you were wondering, when you see this picture of an acupuncture model, and we always see there's all of these lines and dots, I want to kind of show you that it's more than just energy. So a lot of people tell me, I don't believe in acupuncture, or this is just, is my energy good? Is my chi good? And I want to say, when we talk about acupuncture points and channels, these are things actually based in real anatomy, because when they developed the medicine 2,000 years ago, what did they have to look at? They opened cadavers, they opened dead bodies, and they looked and they saw blood vessels and nerves and fascia and muscle tissue. And that's how they developed the system. So acupuncture points are usually in places where there's not a lot of electrical resistance. So often in areas of nerve endings, blood vessels, what we would call motor points. So where there's like a neuromuscular junction, and lymphatic vessels. Also, the channels represent also different blood vessels, different nerves, but specifically we work a lot with the fascia, the connective tissue. So connective tissue basically surrounds our muscles, our organs, our nerves, and is very important to us. We also believe nerves travel through connective tissue. And so by working on connective tissue, again, like things like massage, for example, can help keep your nerves really healthy. What we see with the cancer community are specifically like these symptoms, and we can pretty much try our best to help with all of these. So nausea, there's actually a lot of really amazing studies about acupuncture and the treatment of nausea. So, and that's something that we treat very quickly and very effectively. We see results pretty much right away. Any type of pain, so cancer-related pain, but really musculoskeletal pain is something that we're pretty good at treating, helping with sleep, stress, anxiety, again, the fatigue, any vasomotor symptoms. So hot flashes and night sweats is something we treat a lot of. Last night, I was actually at a different panel about perimenopause, and I was speaking all about this acupuncture treatment of these symptoms, but we definitely see a lot in our chemo patients. And then, of course, neuropathy. So there's basically 5 ways that acupuncture is believed to help neuropathy patients. So we know that acupuncture can help increase circulation. And you can see this actually on ultrasound as someone gets acupuncture. You can see improved blood flow to the surrounding tissue. And the idea is that if the tissue surrounding the nerves are healthy, the nerves are also going to get more oxygen and are likely to be healthy. There's a lot of studies about acupuncture helping stroke patients. And there was a great study too showing that acupuncture can help reduce inflammatory markers. And so again, creating a less hostile environment for our nerves to remain healthy. Acupuncture also can help stimulate nerve growth factor. So these are proteins that are essential for keeping nerves healthy and strong. The other 2 would be acupuncture can help activate some neuroplasticity and modulate the pain response. So when you think of acupuncture, I would say think of helping you reduce pain. What's really cool is the more recent studies around acupuncture are actually having people getting brain scans or doing MRIs and seeing what points are affecting which parts of the brain. So if you look in the picture where it says KI7, that stands for kidney 7, that's a specific acupuncture point. And they started to map out when we do certain acupuncture point, what's happening in the brain. So one of the studies was done where it says GB37, that's a point called gallbladder 37. This point has been in the Chinese textbooks for probably over 1,000 years, and it's a point that we use. It's in the leg, and it's a point that we use for eyes. So floaters, blurry vision, that type of condition, or those types of symptoms. And you can see under MRI, when you get this acupuncture point in the leg, GB37, the occipital lobe is what's lighting up. And that is so cool and validating as an acupuncturist. Of course, I'm biased. I know acupuncture works, and I know what each point does and how it's going to work in the body. But it's so cool now that we're becoming more integrative into the conventional world. I would say there's so many huge hospitals like Sloan Kettering that all have acupuncturists on staff or have some sort of integrative medicine department. And that is just such an incredible thing for our profession. It's something we're really excited about. But we can see here that acupuncture has measurable effects on the brain, which is so incredible. And over time, we're able to objectively measure acupuncture working. So now they're testing things like heart rate variability, or we even have patients who come in and they're wearing their Aura ring or some sort of biomarker device. And they're showing us, wow, like before the treatment started, I was at this many beats per minute with my heart rate, and now I'm at this after the treatment. Or they can see the night that they get acupuncture, their sleep cycle was improved in some way. So it's kind of been amazing to meld like East and West and see where science is taking it. I've got a lot of questions about treatment plans. So it's time for us to have like a little bit of a real talk so I can help manage some expectations specifically around neuropathy. I always say acupuncture is a therapy. It is not a procedure. So each person gets assessed individually. the longer you've had neuropathy, the longer it takes to treat it, or the harder it is to treat it. So I would say the second you start having symptoms, numbness, tingling, weakness, start getting acupuncture. You'll get results much quicker, and we're more likely to be able to help you. I also say that there are other symptoms we mentioned, the nausea, anxiety, extremely easy for us to treat, extremely quick results. Neuropathy is known to be a complex thing to treat in the acupuncture world. So it is not a quick fix. I don't have a magic wand. Unfortunately, we have patients all the time here who are frustrated with sometimes that it can take a long time to treat. And unfortunately, that is just the reality with this condition. I remember being a student in school, and there were two conditions that were known to be extremely difficult to treat. One was peripheral neuropathy, and the other was tinnitus, ear ringing, which we see all the time in the clinic. We see results with both of these things, but you need to make sure you're going to a good provider or someone who works with the cancer community and has experience with neuropathy. There's also hundreds of styles of acupuncture out there. So even if you've tried acupuncture and maybe didn't get the results you wanted, you might just need to try a different style. Think about it like therapy, where you go to a mental health therapist, but EMDR didn't work, but cognitive behavioral therapy was a better fit for you. Acupuncture can be the same. Most people don't realize that there's so many different types of acupuncture. In my clinic alone, I practice a very specific style, and every provider that works here practices a different style than me. What's great is it makes it a well-rounded clinic. So if I'm treating, let's say, a neuropathy patient and I'm not seeing the results I want, I can say, let's try a different style. So don't give up on it, but there is a treatment plan involved. It's not a few sessions. It's going to be more than that. I would say if you had 6 sessions and we saw no results, I would really reevaluate. We're never trying to keep people here. We're always trying to get people better and out the door. But there are just stubborn cases. And with neuropathy, I would say 8 to 12 sessions is more of a fair shot of really giving acupuncture a try. If you just have severe neuropathy, again, because of the medications, the chemotherapy, the treatments that you've been on, it might be a longer term plan for you. So there are cases, again, like there are people we treat with certain nerve issues. I'll say something like sciatica or carpal tunnel, where they're having nerve pain. Within a few sessions, they're gone and we don't see you again. With chemo-induced neuropathy, it can be just a longer term maintenance plan. So maybe we get you to a really good place, and then we say, you know what, why don't you come every 6 weeks just as a maintenance, like a little tune-up is what we would call it, to keep it going. So our goal is to get people out. But again, realistically, with neuropathy, I wish I could tell you otherwise. It's hard to treat. It just is. There's definitely pros and cons to getting acupuncture for neuropathy. So pros would be acupuncture is extremely safe. The worst case could be like a little bruise or bleeding. It is such a safe. I always joke with people, my malpractice insurance is extremely low compared to any other healthcare provider because the risk is so low. Again, it's a non-pharmaceutical option. So most likely you're already on a lot of medications and you might want to try to not go on medication, or you've tried certain medications for neuropathy and they still haven't worked. So this could be a good option. Acupuncture, yes, I know that we're sticking needles in you and it doesn't sound very pleasant, but I promise you it's actually so relaxing. It does not hurt at all. Most people come and they're so excited for their sessions and they take a little nap on the table. And again, you're getting this one-on-one individualized care, and we are here to listen to you to validate your experience, which I know when you're going in and out of hospitals is extremely tricky and difficult. And I would want to be as honest as possible. I always try to keep it so real. Some of the cons are time. So if you're going through chemotherapy, you're at the doctor often, it's hard and challenging to have more appointments and feel poked and prodded in some way. So we always really respect that when we create treatment plans for people. We try, especially with neuropathy, to get people on a very solid plan so we can really see results. It's almost like dosing medication. If you space out the treatments too far apart from each other, then you'll snowball back a little bit in terms of your progress. So we try to get you on a good treatment plan, but we also try to understand you're going through so much. What you're going through is so difficult, so stressful, and you might not be able to drive to your appointment. So we always try to work with people. Another thing can be cost. So again, as acupuncture, as more studies and research comes out, we're becoming more included in in conventional medicine and getting more coverage for insurance. So our clinic is in network with Blue Cross Blue Shield PPO. We're out of network with Aetna and United. And so we try our hardest to get people coverage, but your plan still might not have coverage. So then again, that can be an extra cost when you already on top of your other medical costs. And again, finding good providers can be tricky. So again, like making sure people have the right credentials. I'm always happy if you live out of Chicago and tell me where you live. We help people find providers all over. Once you're an acupuncturist, you can see what's their training and like, you know, what schools they went to and have a good sense if they're a good provider. Some basic lifestyle advice that we would give people going through neuropathy is low impact movement. So like Dr. Geisler said, I love yoga as well. Tai Chi and Qigong, that's part of Chinese medicine. So when you're an acupuncture student in our schooling, we all take Tai Chi and Qigong. And there's actual studies about how Tai Chi prevents falling. So if you have neuropathy and you're more at high risk for falling, something like Tai Chi and Qigong helps improve your balance and your stability and core strength and can really help reduce the risk of you falling. If you're looking for sometimes, often park districts have great like Tai Chi classes on a weekday. So that can be such an incredible thing to add. Definitely a nutrient dense diet. So again, I know it's hard if you're already having low appetite to get nutrients in, but eating just, again, I completely agree with Dr. Geisler. Again, Mediterranean diet, low inflammatory diets. So eating your fish, eating whole foods, very vegetable heavy, and avoiding alcohol, smoking, and reduce caffeine. And another one is nerve flossing. I actually learned this from some of my patients who have been to Shirley Ryan downtown. And it's basically a gentle series of movements that helps your nerves move more freely. And so you can look up just free YouTube videos on nerve flossing and do a bunch of series, like super simple with the arms and the legs. And we found that our patients find that really helpful. This chart lives in every single treatment room in my clinic. And on top, it says healing is not linear. I love this chart because it shows our expectations versus reality. And this is so true, especially with neuropathy and acupuncture care, that we can expect, okay, I'm starting to get acupuncture. Every day I should get 100% better. It doesn't really work that way, unfortunately, especially when you're going through chemo or you're on certain medications. It's just a harder thing to treat. So sometimes you're going to look up and down, but eventually what we want to see is that you are making progress. So if you're in a series, let's say of flare-ups, that we would want to see that your flare-ups become further apart from each other and less severe each time. So acupuncture can help improve numbness or tingling, burning, shooting pain, the pins and needles. And there's a lot of different styles of acupuncture that can help with neuropathy. So again, it's just about finding the right provider for you. So I just want to thank you so much for having me. It's been such an incredible talk. I've already learned so much. And yeah, we're in Northbrook. If you have any questions, please reach out. And thank you.
Thank you so much, Dr. Berkowitz. That was such great informative information about acupuncture. And then also, thank you so much for the candor about acupuncture, complementary care, treatment that's going on right now in regards to neuropathy. Okay, we will now open up for questions for Dr. Geisler and Dr. Berkowitz. Several have come through during their presentations, but if you happen to join us late or you have additional questions, please continue to ask them. Again, if you don't feel comfortable doing so in the chat, you can email us at info@rolfefoundation.com. As always, this is a reminder that our Wellness Wednesday programming is strictly educational. We understand this topic is very personal, and while we want to answer everyone's questions, we unfortunately must refrain from questions targeting individual medical advice. Please seek out your trusted medical team for issues related to your specific health situation. Okay, we've got some questions coming through here. The first one that I see, a viewer has asked, can neuropathy be reversed? Or if I stop chemotherapy drugs, will my neuropathy symptoms decrease as the toxins leave my body?
Yes. In actually quite a lot of patients, it gets better after chemotherapy is stopped. But and then it can get better for quite a long time. So even if it doesn't get better right away, over time, even after 2 years, it can still get better. So the peripheral nerves, so in contrast to the brain, where, you know, when you have a stroke, there's only very limited regeneration, but peripheral nerves can regenerate. So there is actually a good chance that peripheral neuropathy can get better.
Great. Dr. Geisler, we have another question here. Many cancer patients who are now suffering from chemo-induced peripheral neuropathy have what's known as survivor's guilt and feel like they shouldn't complain about their neuropathy symptoms since they are thankful that they are alive. Dr. Geisler, do you encounter many patients who struggle with this ancillary fight, i.e. battling peripheral neuropathy, and how do you advocate for them?
Yeah, I see a lot of patients with chemotherapy-induced neuropathy, and I maybe haven't necessarily. I mean, I do think I don't know. I haven't maybe encountered this survivor guilt. I think having peripheral neuropathy is a big problem, and I don't think that anybody should, you know, think they are complaining. I mean, it's a big problem that needs to be addressed, and hopefully we find better treatments. And until then, we have to do our best to support patients with peripheral neuropathy by combining symptomatic pharmacological treatments and non-pharmacological treatments, and developing new treatments to be more effective, to better help patients with peripheral neuropathy.
Absolutely, yes. Um, Dr. Berkowitz, can acupuncture help with imbalance?
Imbalance meaning, is it like, when people say imbalance to me, that can mean two things. One is just feeling like not aligned, like imbalanced in their hormones, and one can be like physically like helping improve balance so they walk and they're not at risk of falling.
I don't know the background.
Yeah.
Could you actually cover both?
Yeah, sure. Yeah. So we talk a lot about this idea of imbalances. It's a big theme in Chinese medicine because Chinese medicine, I didn't get into the theory, but we talk about these concepts of yin and yang. And so the whole concept of traditional Chinese medicine is to create balance in the body. So when we have pain and dysfunction, it means that there's an imbalance somewhere. And the goal of the acupuncturist and our job is to see where is there an imbalance, and that's going to be in the meridian, the channel system that I spoke about briefly, and then figuring out how can acupuncture correct that, what we would call chi flow, what we would call circulation. Or so yes to that. And
Right.
then balance in terms of falling, I would say this, like we treat certain conditions like foot drop. So people who are having neurological problems and it is causing them to be very high risk for falling. So I would say almost indirectly, yes, but not directly, if that answers.
Sure, absolutely. Thank you for going into detail there. We have one individual who said that tingling started in the toes of both feet during chemo. It spread from toes to mid calves over several years since chemo stopped. In your professional opinion, could this continue to spread more? And if that's the case, then how?
Shouldn't. So I would for sure be, you know, to be sure to see a neurologist to look for other causes of neuropathy. So it should, once chemotherapy is done, and until a few months after, it can get worse, but after this, it shouldn't. So I would look for other causes.
Great. Okay, thank you. Dr. Berkowitz, you mentioned that there are differences between one acupuncturist to another. Could you go into a little more detail about what that means?
Yeah, I'm happy to. So, you know, if they're licensed and they're board certified, then we've all had pretty similar training. But then people go into specialties after graduation, just like any physician would go have fellowship or residency. So it kind of depends like where you do your continuing education. So I practice a specific style of acupuncture. It's called balance method. It's from Taiwan. It's like a very specific way I treat everything distally, so through the hands and feet, even if it's a problem like I'm treating headaches. I have another provider in my clinic that he specializes in something called Japanese acupuncture. He only uses about 4 acupuncture needles, where I use an average 10 to 12. So again, it's a different theory. The treatment is going to look very different. And he even uses different needles from me. And then just in contrast of us both, we have another provider here who is more, I would say, like Western in her acupuncture. It's we call it like motor point needling. So she does local treatment. So for example, if you have a big knot in your shoulder that's always there and it feels like a hard rock, she'll go in and stimulate it until the muscle releases. And she also does electrical stimulation. So for neuropathy, that's a big thing people have told us is they use e-stim. So a lot of people, when they go to their acupuncturists, have had this where we put there's certain acupuncture points along the tibial nerve, and we put electrodes there, and we can see the toes, move and like flex and extend a little bit as we do the acupuncture. So you'll get a little bit something different depending on who you go to. And again, like not every style's for every patient. The benefit of like a clinic like ours is just that we do have our patients are exposed to different styles. But again, like if you're seeing an acupuncturist and they only do one style, you're not getting the results you want, just switch clinics.
Wow, I had no idea before this presentation that acupuncture was so varied, where if it doesn't work with one practitioner and their methodology, it could very well work with a different type of acupuncture. That's fascinating. Thank you for sharing. Another question we've got here is, Dr. Geisler, can neuropathy occur a year or longer after chemo treatment?
Yes, pretty long. So yeah, I would again go to a neurologist. I would really look for other causes of peripheral neuropathy.
Okay. Can you discuss situations where CIPN is asymmetrical, but a neurologist finds no other underlying issues? We have a viewer who said that they were told by a neurologist that it can often be asymmetric, and when she sees it, it's mostly accented on the left side of the body.
So I see chemotherapy-induced neuropathy is typically actually quite symmetric. So if it's asymmetric, I would look for other causes again, especially coming from the back, and that like pushing some on the nerve root, and also making sure that there's no inflammatory neuropathy. So chemotherapy is quite often quite symmetric, mostly. One other thing and that there's one side more affected than the other. No, I've never heard this, never seen that.
Okay. Great to know. Okay. How does one know definitively if they have neuropathy and they also have type 2 diabetes? How does one know definitively, or if they can, if neuropathy is being caused by the chemo or diabetes?
Yeah, that's a really good question. That's a very important question. So we would think that it's most likely caused by chemotherapy. So diabetes by itself increases the risk of chemotherapy-induced neuropathy. But then we would basically expect that the patient doesn't have neuropathy or very mild neuropathy at the beginning of chemotherapy. And then while chemotherapy is administered, the neuropathy gets worse, quite a bit worse. It should be still sensory predominant. And that's more for your neurologist, but affect large fibers more than small fibers. Whereas with diabetes, it affects small fibers more than large fibers. So we can distinguish it, but I would say what's really the criterion is that it gets worse or starts during chemotherapy if there is chemotherapy-induced neuropathy.
Okay, great, thank you. Dr. Berkowitz, a viewer is interested on the effects of acupuncture and myofascial massage for peripheral neuropathy, and also why sometimes it feels like you're being electrocuted.
I would say if you feel like you're being electrocuted, something has gone horribly wrong. You should never feel that way. There's cases like there are certain acupuncture points that have a nervy feel. Like, so an example would be when we treat nausea, there's a very well-studied point called pericardium 6, and it's like right here along the median nerve. And so sometimes when we needle that, people can get like a tiny shock for a second, which is normal, then it goes away. If you're feeling like you're being electrocuted in any way, most likely you are having some sort of like e-stim with your acupuncture, then that means the charge was too high, the acupuncturist is too aggressive. Like I feel acupuncture should be comfortable always. And never uncomfortable for a patient. That's my hot take. And myofascial massage, I love massage therapy. I see it also with helping with like there are certain massage therapists I know that specialize with lymphatic drainage and can be so helpful with cancer patients. So I think myofascial release is wonderful. And I would say that what would differentiate it for me is its shorter term effects. And I feel like acupuncture is a little bit of a longer term effect.
Okay.
But both
Great.
amazing.
Yes, I'm grateful to hear that feeling like you're being electrocuted is not a standard.
Correct.
Great. Okay. Someone has asked about Botox. Could either of you speak about if Botox helps decrease the pain in with neuropathy?
No, I don't think so. There are no data
No.
on it.
Great. Also in the similar vein, has I believe it's pronounced Juvent, Juvent, has Juvent low vibration platform therapy helped in the sphere of neuropathy? Is that
I'm
something
actually not familiar with it. I know that TENS can be very helpful, and I do recommend it for patients who have very localized pain. But that I'm not familiar with.
Sure.
Me neither.
Great. Let me see here. Is there any therapy for neuropathy in the feet specifically to overcome always feeling cold?
That's really tough. That's really, really very difficult. No, not really. If so, there are two different things. Either the feet are really cold, or sometimes the feet just feel cold but are not cold when you touch them. If they're really cold, I would just warm them and hopefully feeling get better. If they are not cold but feel cold, there's not much I can do. Maybe acupuncture.
Yeah, so with acupuncture, I feel like we do, and it's almost like you can feel how cold people's feet are too. I know it's their
Really?
subjective experience, but like sometimes I feel people's feet, it's like ice. So what we use in our clinic, and all of our neuropathy patients love this, and I have no idea if there's any research behind this, Dr. Geisler, is like infrared heat lamps. So just as part of acupuncture, again, like because we're putting needles in people, we try to make the experience as like completely comfortable and restful as possible and keep everyone nice and cozy. So all of our tables will have bed, like, warmers on them, and we give everyone a blanket. And so one of the things we do is everyone has cold feet. So many women, even without neuropathy, complain about their cold hands and feet. We have these standing infrared heat lamps, and we put them over everyone's feet just as a way because it just feels really nice. But I feel like specifically the people with neuropathy are always like, turn it up, It always makes me a little nervous because it gets hot. But they feel like it really, I think, like penetrates like a little deeper than just putting like a heating pad on their foot. And so we've gotten some results with that, or definitely like love to put that always on a person who has neuropathy.
Oh, that's great. I bet that really does help to feel cocooned and warm.
Yeah.
All right, we have a few more coming in here. Have either of you heard of neurobiological electrical stimulation done in water? And if so, does it help with PN?
Mm-mm.
Interesting.
Sorry.
No, that's okay. This is what this is here for. Okay. If one is many years out of chemo, is there anything to do for SARM-1, or is it only mid-treatment?
Yeah, it's probably most effective, we would think, during chemotherapy, basically preventing axon degeneration. Once axon degeneration has happened, there's probably no role for someone. That's what we think at this point.
Okay. All right. Thank you. What is recommended for long-term CIPN? This viewer has been out of active treatment for 8 years, and they're still dealing with it. I think this is there for either of you.
Yeah,
Are there any
that's
thoughts on
unfortunate.
that?
That's unfortunately not uncommon. There's still a chance that it can get better over time, but it's basically at this point, it's symptomatic treatment. It's very important balance training, physical therapy, yoga, and then treating numbness and treating the tingling and pain with medications.
Okay. Dr. Geisler, you mentioned, oh, I'm so sorry. Go ahead, Dr. Berkowitz.
I didn't say anything.
Oh, I'm sorry. Hearing things. Please forgive me. I'm sorry. We did have a question come in, Dr. Geisler, in regards to info for signing up for phase 1 trials with Eli Lilly and Neurobio. Do you have
Yeah,
any?
I actually, unfortunately, I'm not involved in any of those clinical trials at all. We did the basic studies, but yeah, I really don't know where to sign up.
Okay. Do either of you recommend compression stockings when dealing with PN? What are your thoughts on those?
I would try and see how it feels. Some of my patients like it, but then other patients, they can't even tolerate bed sheets on their feet. So it's really quite, it doesn't help to improve the neuropathy, but it can, some patients feel better with it, whereas for others, it would be very uncomfortable. So it's just really personal.
Got it. And also here, I just want to interject a little bit. We want to be cognizant of time here. So I know that we are over the 1 hour mark. If you have follow-up questions that we're not able to get to, please feel free to still email us or reach out to us and we will do our best to answer those. I just have 1 or 2 more here before we let you go onto your afternoon. What I believe this is for Dr. Berkowitz. What do you suggest for patients who want to try integrative medicines but can't afford it, and the treatments either aren't covered by insurance or the centers near them don't accept insurance?
Okay, so there's something called community acupuncture. And there are these acupuncture centers that instead of coming in, being in your own treatment room, it's a room full of chairs. It's actually what we do at Cancer Wellness when we were going to Cancer Wellness Centers space, is we were sitting literally at in a conference room with like big chairs and everyone sat around a table and the acupuncturist went around and did acupuncture. So there are community acupuncture clinics that are donation based or just very low cost, like $20 a treatment. That's one option. And they're usually very good. And the people running the clinics are so heart centered. They're doing it because they want acupuncture to be accessible for people. So Chicago has a few good community clinics that you can go to. So it's not, you're not, there's no privacy. You're in a room, but it's still relaxing and works and it's wonderful. Another good option is to go to acupuncture schools. Every acupuncture school has a student clinic where you're getting a student's treatment and they're new at working with needles, I'll say. I did the same thing, but they're supervised. And so they're getting good advice from instructors who know what they're doing. And I remember I had a patient in my student clinic who had such severe lymphedema. And she was like I think my first person I ever treated with cancer, and just seeing like, wow, how much even the lymphedema is affecting her, the feeling in her hands and everything. So definitely a community clinic or a student clinic. And then also calling your insurance company and requesting, the more people that call their insurance companies and request acupuncture to be covered, hopefully the more that's going to help us get the coverage. But so we're trying our hardest, I'll say.
Yeah, I'm really glad that there are resources available.
Yeah.
It's especially very innovative to think of go to the training centers and those sort of things. They are supervised.
Yeah.
Great. Folks, we are going to finish up our Q&A here. I'd like to ask each of you, Dr. Berkowitz going first, what are 3 key takeaways you hope people walk away with from this conversation today?
So I'm hoping if you were scared or apprehensive about acupuncture, you know that it is safe and evidence-based and you would be in such good hands that it can help you. Also just that acupuncture can support nerve health. And last but not least is healing's not linear. So you can heal, but it can take time and can feel like sometimes you're moving backwards, but as long as you're doing even the physical therapy, myofascial, whatever you're choosing to do, know that all of those things are helping you move in the right direction.
Perfect. Thank you. Those are great. Dr. Geisler, please share with us 3 takeaways.
Yeah, if you have chemotherapy-induced neuropathy, it's very common. You are not alone. Quite often, chemotherapy-induced neuropathy can get better over time, and there are new treatments on the horizon. Hopefully, help more patients soon.
Great. Thank you both so much. Thank you both to Dr. Stephanie Geisler and Dr. Zahava Berkowitz for sharing their time and expertise on such a crucial topic. Huge thanks as well to Cancer Wellness Center and the Foundation for Peripheral Neuropathy for partnering with us today. Links for all parties involved are available in the chat, including more information about Rolfe Pancreatic Cancer Foundation's upcoming 2025 events this summer and fall. Check out our website for more details and be sure to connect with us on social if you haven't already. We'll be announcing details for our next Wellness Wednesday soon, and if you have ideas for future topics or speakers, email us at info@rolfefoundation.org. On behalf of everyone at Rolfe Pancreatic Cancer Foundation, Cancer Wellness Center, and the Foundation for Peripheral Neuropathy, thank you for joining us today, and we'll see you next time.